Gallup released a poll 2 weeks ago that found 55% of Americans now say their financial situation is getting worse. That number is higher than at any point since 2001. Higher than during the 2008 financial crisis, when banks were collapsing and 8.7 million people lost their jobs. Higher than during the pandemic, when 22 million Americans were thrown out of work in a single month. 55%. And this is the 5th consecutive year that more Americans say their finances are worsening rather than improving. 5 straight years. The only comparable multi-year period where the majority felt their financial situation was deteriorating was during the Great Recession. And Gallup's Economic Confidence Index dropped 11 points in a single month to -38 in April, meaning Americans are more pessimistic about the direction of the economy than at almost any point in modern polling history. 62% are worried about not having enough money for retirement. 60% are worried about being unable to cover medical costs in the event of a serious illness. 54% are worried about maintaining their standard of living. And these are not dramatic people being polled after a bad day. These are the measured longitudinal responses of a nationally representative sample collected by the most respected polling organization in American history over a 2-week window from April 1st through the 15th. This is how America feels right now. And the feeling is not irrational. The feeling is backed by every piece of economic data that has come out of the federal statistical agencies in the past 12 months. And the question that nobody in a position of authority is willing to answer honestly is whether this is a downturn or whether this is the new permanent condition of American economic life. 55% feels like a number until you realize what it means in human behavior. When 55% of a nation says their finances are getting worse, the behavioral consequences show up everywhere simultaneously, and they cannot be hidden by any headline statistic. The Century Foundation's national survey documented that 1 in 3 Americans, 34%, skipped a meal in the past year because of cost. That was up from 1 in 4 just months earlier. Nearly 3 in 10, 29%, delayed or skipped medical care. Among adults, 18 to 29, nearly half, 49%, delayed care. 1 in 4 Americans delayed buying prescribed medication. 29% dipped into savings to cover everyday expenses. 28% are using credit cards more than they were a year ago. Buy now, pay later, usage is climbing. And a growing number of Americans are financing their weekly groceries on installment plans because they cannot afford to pay for food at the register. McKinsey's fourth-quarter research confirmed the pattern. Nearly a third of adults reduced their savings rate. Credit card delinquencies climbed to the highest level in almost a decade. Auto repossessions hit the highest since the 2008 financial crisis. Student loan delinquencies are rising at record pace. At least 717 companies filed for bankruptcy through November 2025, a 14% increase from the year before, including recognizable names like Spirit Airlines, Monte Foods, and Rite Aid. These are not abstract financial metrics. Spirit Airlines was the airline that working-class families used because it was the cheapest option. Monte Foods was on the shelf of every American grocery store for a century. Rite Aid was the pharmacy on the corner of communities across the country. When those companies go bankrupt, the communities they served lose the services they depended on, and the employees lose the jobs that paid their rent. And employer-sponsored healthcare costs are projected to rise 8 to 9% in 2026, with family premiums for workplace plans approaching $27,000 per year, according to an analysis from A1. $27,000 for a family health plan through an employer. That is more than a third of the median household income devoted to a single benefit that used to be included as a standard part of employment. And 27% of Americans told the Alliance survey they have decreased confidence in their ability to meet their retirement goals compared to a year ago. Not compared to 5 years ago, compared to last year. The erosion is happening in real time and it is accelerating. America now ranks 46th in life expectancy, and nobody is asking why the richest country on earth is watching its people die younger. In 1950, the United States ranked 12th in the world in life expectancy. Americans lived longer than citizens of almost every other nation on Earth. By the time the most recent comprehensive data was published, America had fallen to 46th, not 20th, not 30th, 46th. Behind Costa Rica, behind Chile, behind Slovenia, behind every single Western European country, every Nordic country, every major East Asian economy, and a growing list of nations that Americans have been conditioned to think of as developing countries. And the decline is not just relative. American life expectancy dropped in absolute terms during the pandemic to 76 years, a level not seen since nearly 2 decades earlier. Other wealthy countries experienced the same pandemic and their life expectancies rebounded. America's did not recover at the same rate. Maternal mortality in the United States is triple the OECD average. Triple. American women die in childbirth at 3 times the rate of women in comparable countries, and black women experience maternal mortality at 3.5 times the rate of white women, a disparity that has persisted for decades. Infant mortality ranks worst among peer countries. Pediatric mortality rates are rising for the first time in memory. The Journal of the American Medical Association published a paper finding increasing mortality rates among American children and adolescents, and the lead author, Stephen Wolfe at Virginia Commonwealth University, said this was the first time in his career he had ever seen pediatric mortality increase, that it had always been declining for as long as he could remember, and that it was now increasing at a magnitude not seen for at least half a century. Drug overdose deaths quadrupled since 1999, with nearly 500,000 Americans lost to opioid overdoses alone. Suicide rates increased 35% from 1999 to 2019. Youth suicide rates increased 57% between 2007 and 2018. Nearly 1 in 4 young girls have been found to self-harm. People experiencing homelessness die nearly 30 years earlier than the average American, with the average age of death ranging from 41 to 51 years. And the United States spends more on healthcare per capita than any other country on Earth, twice as much as the next highest. We are spending the most and dying the youngest among our peer nations. And nobody in Congress, nobody in the White House, nobody on any cable news network is asking the obvious question: what is this money buying? Because it is not buying longer lives. It is not buying healthier children. It is not buying safer pregnancies. It is not buying fewer overdoses. It is buying administrative overhead, pharmaceutical profits, insurance company stock buybacks, and a healthcare system that charges the most and delivers the least of any wealthy democracy on the planet. And the states where life expectancy is worst are, not coincidentally, the states that refuse to expand Medicaid. Of the 20 states with the worst life expectancies, 8 are among the 12 that have not implemented Medicaid expansion under the Affordable Care Act. The consequences include closures of rural hospitals and high rates of uninsured residents. Mississippi, the state whose anti-abortion statute led to the Dobbs decision that overturned Roe v. Wade, has the worst life expectancy in the country and the highest infant mortality rate. It is approximately 75 times more dangerous for a woman in Mississippi to carry a pregnancy to term than to have an abortion, as the Supreme Court dissent noted using the state's own data. And the decline in American health is not confined to poor states or poor populations. Princeton researchers Case and Deaton documented rising mortality among less educated non-Hispanic whites starting in 2015, driven by what they called deaths of despair, deaths from suicide, drug overdoses, and alcoholic liver disease. These are deaths caused not by pathogens but by the conditions of American life itself. The opioid crisis, which has killed more Americans than every war since Vietnam combined, is a death of despair epidemic that was created by pharmaceutical companies, enabled by regulators, and abandoned by a healthcare system that could not or would not treat the addiction it had caused. And now that same healthcare system is being cut by $1 trillion in Medicaid reductions, losing its ACA subsidy protections, and imposing work requirements on patients who are too sick to work. The system that contributed to the despair is being dismantled before it addresses the despair it created. Bankruptcy filings are surging, and the companies dying are ones ordinary Americans actually depend on. 717 companies filed for bankruptcy through November 2025, a 14% year-over-year increase. And the companies going under are not obscure startups or speculative ventures that most Americans have never heard of. They are the infrastructure of everyday American life. Spirit Airlines, which carried 32 million passengers a year on routes that connected working families to affordable travel. Monte Foods, which has been in American kitchens since 1886. Rite Aid, which operated over 2,400 pharmacies in communities across the country. When Spirit Airlines collapses, the routes it served do not simply transfer to another carrier, they disappear. The $49 flight from Cleveland to Fort Lauderdale that a grandmother used to visit her grandchildren twice a year no longer exists. The $89 round trip that a young couple used for their first vacation together is gone. And the flights that replace them on other carriers cost 2 to 3 times as much because the competitive pressure that Spirit exerted on pricing has been removed from the market. When Rite Aid closes 2,400 pharmacies, the prescription that a 72-year-old filled on the corner of her block is now a 20-minute drive to the next nearest pharmacy, assuming she has a car, and assuming the next nearest pharmacy has not also reduced its hours or closed. The pharmacy desert phenomenon mirrors the food desert phenomenon that has been documented in low-income communities for decades. Entire neighborhoods, entire rural towns are losing access to the physical infrastructure of daily life, and the bankruptcy wave is not slowing. High interest rates make debt refinancing more expensive. Consumer spending is contracting. Commercial real estate is in distress. And the companies that survive are doing so by cutting staff, cutting locations, cutting hours, and cutting the quality of service that used to be the baseline expectation of American commerce. You can feel it in every store that has fewer employees, longer lines, and more self-checkout kiosks than it had 3 years ago. You can feel it in the hold time when you call customer service. You can feel it in the restaurant that reduced its menu, raised its prices, and eliminated the server who used to refill your coffee. The erosion of service quality across the American economy is the visible expression of the financial distress underneath. The companies that serve you are running out of margin, and when they run out entirely, they close. And you lose another piece of the infrastructure that made your daily life functional. Rural hospitals are closing at a rate that has left millions of Americans more than an hour's drive from emergency care. Between 2010 and 2024, over 150 rural hospitals either closed entirely or stopped offering inpatient services. The communities they served did not get replacement hospitals. They got nothing. A heart attack in rural America in 2026 means an ambulance ride of 60 to 90 minutes to the nearest remaining facility. If an ambulance is available, if the roads are passable, if the patient survives the transit time. Maternity wards are closing across the country, creating what healthcare researchers call maternity care deserts, counties where there is no hospital offering obstetric services, no birth center, and no certified nurse midwife. More than a third of U.S. counties are now maternity care deserts. Grocery stores are closing in low-income neighborhoods, creating food deserts that force residents to drive 30 minutes or more for fresh produce, or to rely on convenience stores and dollar stores for their nutrition. Dollar General alone has more stores in America than Walmart and McDonald's combined, and in many communities it has replaced the grocery store entirely, offering shelf-stable processed food with no fresh meat, no fresh dairy, and no fresh produce. The infrastructure of American daily life is being replaced by a degraded version of itself in which the cheapest, lowest quality option is the only option, and the communities that need the most are served the least. Working-class Americans are living in a parallel economy that bears no resemblance to what is described on television. Roosevelt Institute principal economist Michael Matowitz wrote in January 2026 that another vibe shift is underway, but the vibes are still bad, and they are starting to come from a weak job market more than high inflation. Americans remain very concerned about affordability, he wrote, but it is increasingly a function of a weak job market and weak income growth rather than the price growth story that has dominated headlines since the pandemic. That shift matters because it tells you the problem has metastasized. It is no longer just that things cost too much. It is that things cost too much, and the money coming in is not keeping up, and the jobs that were supposed to generate the income are disappearing, shrinking, or being replaced by hourly positions with no benefits and no stability. The Century Foundation documented the class divide in granular detail. Working-class voters are more likely to skip meals, skip medication, fall behind on bills, carry debt, rely on payday loans, and work in unstable hourly jobs with low pay. 53% of working-class respondents are paid hourly, compared to 27% of college-educated respondents. 19% take payday loans versus 10% of college-educated respondents. 36% use buy now, pay later versus 24%. And the gap between those two economies is not closing. It is widening. Because the forces driving the divergence, automation, offshoring, the collapse of unions, the shift from manufacturing to services, the rising cost of education, the credentialing of jobs that did not previously require degrees, are structural. They are not policy accidents that can be reversed with a single piece of legislation. They are the cumulative result of 40 years of economic design choices that concentrated returns at the top and distributed costs at the bottom. And the Iran war has added an energy shock on top of a structure that was already failing. Gas prices rose from less than $3 to above $4 in a matter of weeks. The March CPI showed energy up 10.9% in a single month. And the people who are hurt most by energy price spikes are the people who drive the farthest to work, who live in the oldest houses with the worst insulation, who heat with fuel oil because their homes are not connected to natural gas, and who spend the largest share of their income on the basic inputs that oil prices affect. Every energy shock is a regressive tax. It takes a larger percentage from the people who have the least, and the current shock is landing on a working class that was already skipping meals, skipping medicine, and financing their groceries on installment plans. And here is the part that the optimistic economic forecasts do not account for. RSM's 2026 outlook projected above-trend growth of 2.2% and reduced their recession probability to 30%. That forecast was published before the Iran war, before the ceasefire collapsed, before the March CPI spike of 0.9%, before consumer sentiment hit its all-time record low, before the IMF issued a global recession warning 2 days ago. Every optimistic forecast published before February 28, 2026 is based on a world that no longer exists. The war changed the trajectory. The ceasefire failure confirmed the trajectory. And the working-class Americans who were already drowning before the war are now drowning faster in deeper water, with fewer lifelines. The Century Foundation specifically warned that with even greater price hikes on the horizon in 2026, leaders in both parties should act decisively to make life in America more affordable and fair. That warning was published in February, before the war. Since then, 250 million Americans face health insurance premium increases far exceeding inflation, wage growth, and Social Security adjustments, price hikes that the Century Foundation described as having few historical parallels. The working class is not experiencing a different version of the same economy. They are experiencing a different economy entirely. One where the basic mathematics of survival, rent plus food plus healthcare plus transportation plus utilities, exceeds 100% of income. And the gap is filled by debt that compounds, by savings that deplete, by health that deteriorates, and by a future that shrinks with every month that the gap persists. Nearly half of Americans say they are more stressed entering this year than last year, and that number was already at a record. The Street reported that nearly half of Americans said they were more stressed heading into 2026 than they were at the beginning of 2025. That is not a poll about the economy. That is a poll about the lived psychological state of the American population, and the University of Michigan Consumer Sentiment Index, which dropped to 47.6 in early April 2026, the lowest reading in the entire 75-year history of the survey, confirms that the stress is not just emotional, it is financial, physical, and existential. People are not anxious because the news is scary. People are anxious because they cannot pay their bills, cannot afford their medicine, cannot see a path to retirement, cannot afford to have children, cannot afford to get sick, and cannot afford to die. The cost of dying in America, the funeral, the burial, the estate administration, now averages $8,000 to $12,000, and many families cannot cover it without a GoFundMe campaign. That is where we are. Americans are crowdfunding their own deaths because the cost of existing has consumed every dollar they earned while alive. And the anxiety is showing up in physical health outcomes that compound the financial distress. The American Psychological Association has documented rising rates of chronic stress-related conditions, including hypertension, digestive disorders, insomnia, anxiety disorders, and depression. Chronic stress suppresses immune function, accelerates cardiovascular disease, and contributes to the metabolic conditions, diabetes, obesity, and heart disease, that are the leading causes of the declining life expectancy I described earlier. The financial crisis and the health crisis are the same crisis expressed in different metrics. The person who cannot afford their blood pressure medication because the copay increased skips the medication. Their blood pressure rises. They develop a cardiac event. The cardiac event generates a hospital bill that drives them into medical debt. The medical debt destroys their credit. The destroyed credit raises their insurance premium and disqualifies them from favorable loan terms. And the cycle restarts at a lower baseline than where it began. That is not a theoretical feedback loop. That is the documented experience of millions of American households right now in 2026. And the system that is supposed to interrupt that cycle, the healthcare system, the social safety net, the public health infrastructure, is itself being cut, defunded, restructured, and privatized by legislation that was passed in the same 12 months that the cycle accelerated. Homelessness has reached levels that should disqualify America from calling itself a developed nation. People experiencing homelessness in the United States die nearly 30 years earlier than the average American. The average age of death for adults living without housing ranges from 41 to 51 years. Non-elderly adults, 18 to 54, experiencing homelessness have a mortality rate 3.5 times higher than the housed population. Even compared to housed individuals living in poverty, people experiencing homelessness face a 60% greater mortality risk. And the conditions driving homelessness, unaffordable housing, stagnant wages, mental health crises, substance use disorders, medical debt, domestic violence, and the simple inability to cover first and last month's rent after an unexpected expense are all worsening simultaneously. Home sale prices up 81% since 2017. Rents up 36% since January 2020. Wages flat in real terms since 2019. One medical emergency, one car repair, one job loss, one divorce, and a family that was housed last month is unhoused this month. And the transition from housed to homeless is catastrophically faster than the transition back. Finding housing from homelessness requires a security deposit that homeless people do not have, a credit check that their circumstances have destroyed, a rental history that their homelessness has interrupted, and an income verification that their unemployment makes impossible. The system is designed to prevent people from becoming homeless. Once they are homeless, the system has almost no mechanism to return them to housing at scale, and the federal response is being cut. HUD funding is under pressure. Community health centers that serve homeless populations received a shock from the federal funding freeze. The government shutdown disrupted SNAP benefits that many homeless individuals depend on for food. And the Medicaid work requirements that take effect in December will strip healthcare coverage from people whose unstable housing makes documenting 80 hours of work per month functionally impossible. You cannot maintain employment documentation when you do not have a mailing address. You cannot maintain healthcare enrollment when you cannot receive the verification letter. You cannot comply with a bureaucratic system designed for people with stable addresses, reliable internet access, and filing cabinets. And the penalty for failing to comply is the loss of the healthcare that keeps you alive long enough to find housing. And there is one more dimension to the American crisis that almost nobody is discussing publicly because the data is too disturbing to put on a cable news chyron. The Surgeon General declared loneliness and social isolation a national epidemic. Americans are more isolated than at any point in the country's history. The average American has fewer close friends than in any previous generation. Church attendance has declined. Community organizations have hollowed out. Bowling leagues, Rotary clubs, volunteer fire departments, PTAs, all the institutions that Robert Putnam documented in Bowling Alone as the connective tissue of American community life have continued to atrophy. And the health consequences of isolation are quantifiable. Loneliness increases the risk of premature death by 26%. It increases the risk of heart disease by 29%. It increases the risk of stroke by 32%. The mortality risk of chronic loneliness is equivalent to smoking 15 cigarettes per day. And the populations most affected are older Americans, who are also the populations most affected by the Medicare Advantage terminations, the Medicaid work requirements, the SNAP cuts, the Social Security Trust Fund depletion, and the cumulative cost of living crisis that this video has documented. The American over 55 who loses their health care, loses their food assistance, cannot afford their prescriptions, cannot find employment because of age discrimination, and has no community institution to turn to for support is not just financially distressed. They are existentially alone in a system that is actively withdrawing the structures that were supposed to catch them. And that intersection of financial distress, health deterioration, social isolation, and institutional abandonment is what the data calls a death of despair. And it is happening at scale, across every state, in every demographic. Right now, every number in this video is from a published, named, verifiable source: Gallup, the Century Foundation, McKinsey, the Bureau of Labor Statistics, the University of Michigan, the International Monetary Fund, the Journal of the American Medical Association, Virginia Commonwealth University, the Roosevelt Institute, The Street, Awan, Allianz, Community Solutions, Interagency Council on Homelessness, the American Journal of Public Health, the Peterson-Kaiser Family Foundation Health System Tracker. These are not opinions. They are the measured, documented, peer-reviewed findings of the institutions whose job it is to tell us the truth about the country we live in. And the truth they are telling us, across every metric, across every population, across every region, is that America is getting worse. Not slowly, not marginally, measurably, acceleratingly, and in ways that are being felt by 55% of the population right now in April of 2026, which is higher than at any point since 2001, which was itself the year the towers fell and the economy entered recession. The feeling is not wrong. The feeling is data. And the data says every American feels it because every American is living it. Share this video with every person you know, not because I need the views, because the information in this video is the first step toward the only thing that can change the trajectory. Awareness. You cannot fix what you cannot name. And America, in 2026, cannot yet bring itself to name what is happening. This video names it. And the naming is not an act of pessimism. It is an act of clarity. Because the only thing more dangerous than a country in decline is a country in decline that refuses to acknowledge it. Denial is not a strategy. Denial is how you arrive at 46th in life expectancy while spending more on healthcare than any nation on earth. Denial is how you arrive at 55%, saying their finances are getting worse, while the headline GDP number looks fine. Denial is how you lose Spirit Airlines, Del Monte, and Rite Aid in a single year and call the economy strong. The economy is not strong. The economy is serving fewer people with less quality at higher cost, while the metrics that measure it are designed to hide the decline from the people experiencing it.